Hey everybody, this is an internal training video to try to give you a quick overview on the toe motion kit. We're going to be doing cases next week and I'll be in Pensacola, so I thought I would put something up for you guys. It's a two-level tray, everything's combined. The top layer is all your DF material. We've added this retractor that a lot of people like from the Checkmate kit. The lower tray is the DF jig, all the trials and everything for the phalangeal side. So I've already got a implant set up on the metatarsal side. I'm going to take you through the steps real quickly. It's a pretty quick procedure on the phalangeal side. The final implant will look something like that. It's a metal tray. We're going to get the metal tray in place, and then we're going to trial the different poly inserts that we like to take up joint space or leave enough decompression. We have a guide in the kit that allows the surgeon to see where the implant will be placed on the phalangeal surface. The one caution here is that a lot of guys are not going to realize that where the guide is sitting is exactly along the axis of the bone, and this is one that requires a great deal of precision. So when you shoot this wire, you're going to want to confirm everything fluoroscopically, because the shape of this bone, sometimes this wire can penetrate back through the bottom. I have not done that, but you'll see in our technique guide we say after this step, confirm the placement of the 1.5 guide pin radiographically before proceeding. If they go past this step and the pin is out the back, the screw will go out the back as well. So they want to, some guys are going to want to feel the phalanx, make sure they know where the axis of the bone is, and to do that and hold the guide is a little much, so I think a lot of people will probably do better if they don't hold the guide and just use it for a sizing tool. I'm going to reshoot this because I did come out the back. I'm going to reshoot this with the tip tracking more dorsally. That's a little too much. And that's perfect. Right down the middle. Again, confirm that radiographically before going to the next step. Then I'm just going to come over this with a cutter. This cuts the pilot hole for the screw as well as the area for the tray of the implant. As you're coming down, this cutter is the profile of the tray. So I'm going to bring this down flush to the surface. Then I still have to create some joint space to allow for the poly. So I'm going to take this down below the surface 1 to 2 millimeters. You'll notice on the dorsal side of the bone, as I'm reaming down, it gets very thin. In fact, if your pin is more dorsal, sometimes you'll ream that away. So use the plantar side and the medial lateral sides to judge your depth. And there I am about, if you look plantarly, I'm about a millimeter below the surface, so that's right where I want to be. I'm going to tap over this just like always, and this you want to go very carefully. Use your AO technique. As soon as it starts getting hard, back to tap out and come back down. This is delicate bone, so we don't want to just drive this tap all the way down in one run. And the laser etch line is getting to the former surface, so I advise you to not under tap on this like we sometimes teach in the other systems, just because this bone is so friable. Now I'm ready to drive the implant. So this is the step where we're going to prepare our implant for delivery. We're going to put it onto the hex driver and then simply take one arm of the suture, put it around the screw, take the other arm of the suture, put it around the screw, provide a little tension, and once I start tensioning that, I can just turn this down. and you'll see that the suture will just roll down. You want it all the way against the base of the implant, so it's making a carriage with both ends going around, and it's all the way at the bottom. When you're there, you're ready to deliver. So I'm going to now just deliver this like I normally would. And I like to hold the delivery tool steady so that I keep the sutures from wrapping. Keep a little tension on them. And then right as I get to the last, call it quarter turn, I want to rotate this delivery tool a little counterclockwise so that as I bring it around to its final position, everything is right where I want it. Don't over tighten this. Be careful. If you put too much stress on this bone, it can crack. So don't drive and drive and drive the implant down until it's completely rigid. My pin has to come out now. And you can see that I now have the implant in place. I have the delivery sutures all around it, and I have a nice area to work there. I'm going to go over to my tray set, and you'll see that based on the medial lateral dimension of the implant, which is either a 1.5 or a 2.5 on the metatarsal side, I'm going to pick the matching phalangeal implant so that I have a conforming medial to lateral radius. So if I use the 1.5/3.5, I'm going to use the 1.5 family. Within this 1.5 set of medial lateral curves, I just have varying thicknesses. So what I'm going to do is make sure I'm happy with the range of motion and not having a soft tissue balance problem. Now, this is my trial. This is a 1.5. The implant that I used on the metatarsal side here is a 1.5/4.5. So I'm just going to loosen this, and it's a little artificial in this model because of the elastic bands, but you see I would be very happy with that range of motion. So I'm going to go with the 1.5 by 1 millimeter thick. Again, that's what the markings mean. It's a 1.5 curvature. That's an 0.1 millimeter thickness. A moment ago when I told you sink this tool, the pilot drill tool, I'm taking it down somewhere between 1 millimeter and 2 millimeters beyond its back margin. That's to allow the room for the poly. This is a 1.5/3.5 implant, 1 millimeter thick, and I'm going to place this into position. You won't notice it here, but there's a very prominent notch. That is dorsal. So we always make sure that the notch is dorsal. And what is helpful here is to have an assistant place a probe or something on here so it doesn't get knocked off while I'm moving things into position. I've done that before in some labs. So I move this up and I pull this delivery tool down. Again, you can see this is a little squirrely, but there is no good way to deliver this implant in with impact or with pressure, and this tool allows you to do that. So I have a screwdriver with a hole and a slot. I'm going to pass the suture through, pull the knot through, and then I'm going to slide the knot down so that it's parked and I can start wrapping up on this shaft. The shaft then turns down and I wind up creating a little clevis and pulley system so that I can just tighten this down now, and you'll hear and feel a snap when the implant snaps into place. Just make sure you're happy with your dorsal location. I'm going to move this over just a tad. You can move it around a little bit before it's snapped in, and even to some degree after, but it takes a lot more force. Okay, now I'm going to click this down. You probably heard that. It's very noticeable live and very perceptible to the surgeon. And then I'm just going to examine it visually to make sure it looks like it's down all the way. Now the easiest way to pull these sutures out, you can do it manually, but I find it just cut one leg from each side. This is fiber wire or its equivalent. It's not, we don't use the Arthrex material, but I like to cut the alternating side of each of these so that I have two cut but still two intact pieces, and then I just go back down and twist this, and it will pull the suture right out from under the implant. And there you have it. Final check, range of motion. You're going to be very happy as they go dorsal. As you go plantar, be very careful that they've done an adequate trim job plantarly. And I left this sort of on purpose a little rough along the bottom, and you'll feel the implant come down, and most people don't have more than maybe 20 degrees of plantar flexion with their MTP. But as you come down to here, you can feel that the implant makes contact, and this part of the interface between the plantar aspect of the implant needs a little trim to make sure you don't engage and click. So just be careful of that. That's highlighted in the technique guide. There are a number of steps that we pointed out. Again, confirm the guide pin placement before you keep going. We talk about the joint space, so that's called out in blue. You want to take this 1 to 2 millimeters deeper to create room for the poly. The delivery tool is described. I think it's not a bad idea to confirm the screw position radiographically before you go on and clamp in the poly component. And then in particular, pay attention to that plantar element around the bottom of the DF articular component, so you do a good trim job down there. Other than that, it's pretty straightforward and should take you about 15 minutes. So best of luck to everybody, and let me know your comments. Take care.